Doctors of Reddit, what's your thank God they came in for a second opinion moment? Oh God, where to start? I literally just admitted this lady to ICU, had been coughing for ages, 60 pounds weight loss, smoker for 50 years now she can't breathe and I got a CT 6 centimeters mass looks very suspicious for lung cancer. And the doctors for 4 years throughout this just gave her vitamin D even though she was losing massive weight and coughing up blood. Another guy who came in looked pale as a ghost. Chief complaint was fatigue. One lab test later found out his hemoglobin was 4, barely on the cusp of survival. Seems like he had iron deficiency anemia for years. Doctor gave him some iron, he got better but no one looked into why he got it. Number 1, 2, 3 reason in an older guy is colon cancer. He died 4 months later from metastatic colon cancer. Another story last month was about to take a long trip across the Pacific. 1 hour in on the flight they ask for a doctor, I volunteer myself. I see this lady literally gasping for air, like waving her hands in the air cause she can't breathe. Look through the meds, she's obviously an asthmatic. Listen to her lungs and faint wheezing, no air movement at all. I later grounded that plane because there was another 16 hours to go and she was on verge of being intubated. Later I get more story from family member. Apparently she wasn't been able to sleep well for past 2 weeks. Doctor just gave her sleeping meds, more and more of it. Told her flying no problem. I asked the family why can't she sleep? Is it because she wakes up in the middle of the night gasping for air, classic sign of uncontrolled asthma? They're like yes, how did you know? Sleeping meds prob among worse things she could have gotten and almost killed the patient by saying she could fly. People who get diagnosed with bronchitis when they have heart failure and literally drowning in fluid. There are doctors who give antibiotics and steroids for everything ESP when they have no idea what's going on. Maybe I'm biased because I work at an academic center so I see all the cases who get referred in because they're too sick or no one can figure out, but at least a few times a week I'm like wow, this person could have been saved or not end up this way if someone cared enough earlier on. I'm going to say this as a doctor. It's honestly scary every day how many patients I see are completely mismanaged. Some doctors in urgent care see like 45 patients in a day. How is that possible to be thorough? Like if only patients knew what the doctors missed or what not. Half the time I really think it's like going to an bad auto shop and not realizing they're just making half the shit up. Same thing happens in medicine and except people's lives suffer because of it. I am a doctor, primary care with some emergency, and can't really think of any good examples of this right now. It's definitely happened, but never in a way that I end up holding it against the other doctor involved. You kind of end up too busy doing your job. One phrase that I find myself repeating to patients is I don't really understand what previous doctor was thinking here, but the way that the guidelines / my experience has taught me to approach this problem is, hopefully correct solution. Most of the time, the fact that the patient has gone looking for a second opinion or another consult tells you about their level of concern and changes your management. Doctor number 1 might see a patient with 2 days of low abdo pain and, correctly, reassure the patient that it's probably nothing and come back in a week if symptoms continue. Patient then goes to doctor number 2 a couple of days later, more worried and cheesed off at number 1. With the increased level of concern, number 2 then orders an ultrasound that reveals ovarian cancer. The issue here is that both doctors are correct. The next abdominal pain that comes in to see either doctor at 2 days of symptoms will still receive reassurance as their primary treatment, because it will most likely be something simple like constipation or cramping. Giving every patient with simple symptoms an ultrasound is not economically feasible. I would hope that any diagnoses I've missed or mismanaged, and I assume there's been a few, were picked up by another doctor and that they also gave me the benefit of the doubt. Do I win by being the first not a doctor? Not a doctor but have had a second opinion save my PP. Noticed blood in my urine and went to family doctor. Family doctor said it was a normal injury and would go away. Went for a second opinion with a urologist and after a bunch of tests they found scar tissue built up in my urethra that was causing inflammation and if left untreated would cause the urinary tract to close. So they removed the scar tissue and I about cried while peeing for weeks after even while on pain medication until it healed. But at least I could still pee and that was thanks to the second opinion. Not a doctor, but I heard my son's doctor say this. I took him to the ER late one night because of coughing and a high fever. They took an X-ray, gave him ibuprofen, and told us he was fine. Doctor showed me the X-rays to prove it and gave me a dirty look when I asked what the dark spots were. I told her she was an idiot and took him to urgent care 4 hours later. The doctor that saw him immediately diagnosed him with pneumonia and confirmed with SRAs. I flat out refused to pay for the ER visit and told them that if they persisted with collections I would push their incompetence. They never called me again. Heard this from an ultrasound tech. A man came in severely injured after a car accident. The man had a laceration above his right thigh along with a puncture wound from his door or something from the car, can't remember. The doctor ordered an ultrasound of this man's leg in order to make sure the vein had not been punctured. The guy was doped up on painkillers by the time he had gotten to the tech, so he was loopy as hell while she was performing the scan. She felt something metallic against his arm when she was positioning his thigh to get a full scan. She asked him if his leg had another puncture wound on the inside of his thigh. He told her no, he just has a massive piercing on his penis, like a fucking bullhorn or some shit. She asked him to position his privates away from her while she performed the rest of the scan. Breaking HIPAA laws, this tech told her husband, at home not at work, about this man's piercing. Her husband was a MRI tech at the same hospital. The next day, the same man was scheduled for an MRI on his thigh. Now MRIs are magnetic resonance imaging, so it's literally a fucking magnet that will fuck up piercings. Because that ultrasound tech had broken HIPAA laws, she actually had saved this man's dick. Her husband warned him to remove all piercings from his body and made sure this man knew that he meant all piercings. Not exactly a second opinion story, but whatever. Bit of a weird one, because the request for a second opinion came from an intensivist and I was a contributor to their treatment plan. I work in poisons control. Had a call from a green, but very astute young doctor with a middle-aged female patient presenting with a vague 36 to 48 hours history of malaise, confusion, hypoxia from hyperventilation, and hallucinations. On workup was noted to have pulmonary edema, lung fluid buildup, metabolic acidosis, acute kidney injury, sinus sticky and raised CRP and WCC, suggestive of infection but no temperature. The initial diagnosis was sepsis. This keen-eyed doctor, pretty fresh out of med school, decided to do a salicylate level on this lady because the hyperventilation paired with metabolic acidosis and AKI was enough to prompt her suspicions of aspirin poisoning, even though they could just as easily be explained by sepsis as well. The level came back high. Not huge, but high, which prompted her to phone me for a second opinion on how relevant the finding was in terms of the patient's clinical picture. Simultaneously, the patient's family investigated the property and located numerous aspirin blister packs suggesting she had been dosing herself for chronic pain, which was present in the medical history. Chronic salicylic poisoning is insidious and has been referred to as a pseudosepsis in the medical literature as it often causes similar features. Comparing a high level in chronic poisoning to the same level in acute poisoning, features are much more severe in chronic poisoning, i.e. pulmonary edema, hypoxia, AKI etc., there is a disparity. We recommended certain treatments, all hail sodium bicarbonate, and the patient made a full recovery after a 2-week hospital stay. Whilst there was no question an infective cause was present and contributory, I was impressed with the green doctor's intuition and willingness to consider other causes. I feel like it greatly improved the patient's treatment. Can I go ahead and speak on behalf of my doctor? 19 meters at the time, 33 now. I felt sick for about a week, flu-like symptoms, didn't want to eat, just felt bad all over. One day at work I feel a very uncomfortable cramp/tear in my abdomen, so I go to one of those 24-hour clinics. At this point I'm slumped over, can't stand up straight without insane amount of pain, just generally uncomfortable and hating life. After a few hours at this clinic, they say you probably have kidney stones, go home, drink fluids, sleep it off. This seemed fine to me. I was ready to go home and listen to the doc, all was good. But my girlfriend at the time, didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER, against my wishes of course. After a few minutes at the ER, they determine my appendix has ruptured and I'm going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6 to 7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else as I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time, and of course, those are the patients that have a brain tumor show up on their CT scans. Edit, well this blew up. Big apologies to everyone, but I'm not a doctor. I work in the hospital alongside other doctors and I get the chance to see everyone they see. Apologies if I misled. That was not my intention, and I will make sure to be clear next time.